Asif Choudhury MD has been fortunate enough to have his career rooted in patient care, clinical responsibility and a consistent commitment to service throughout his career as a physician. For the past 23 years, medicine has been more than just a job for Dr. Choudhury. Each day he practiced medicine by listening, diagnosing and supporting individuals in the midst of their most vulnerable moments. While his leadership qualities, technical expertise and reputation have defined much of his success thus far, in the beginning of his career, it was about creating connections with people. The decision to become a physician was very personal for him because of the experiences in his life, and Dr. Choudhury knew he could make a difference in helping others who did not have access to quality healthcare. That sense of purpose has helped him develop a career that reflects compassion and hard work. The roots of his medical path trace back to family experiences and early observations of illness and caregiving. Witnessing the effects of cognitive decline in a loved one prompted serious reflection on health, memory, and the fragility of the human body. At the same time, strong family encouragement emphasized service and responsibility toward others, particularly those with limited resources. These influences shaped his decision to commit to years of education and training. Medicine represented both an intellectual pursuit and a moral obligation. From the start, he viewed the profession as a way to relieve suffering and restore dignity. Throughout his years in clinical practice, patient relationships remained central. He approached each interaction with patients, believing that careful listening often revealed more than tests alone. Many individuals arrived with fear or confusion, unsure how to explain their symptoms or concerns. He made it a priority to create space for those conversations. By acknowledging each person's experience, he built trust that extended beyond the exam room. This approach fostered clarity, reassurance, and cooperation, which often proved essential to effective treatment. Certain cases left lasting impressions, not because of recognition or complexity alone, but because of the relief and gratitude that followed. There were instances when patients had endured years of unanswered questions or unsuccessful procedures. Providing solutions in those moments brought deep fulfillment. The joy expressed after successful outcomes reinforced his belief in persistence and careful attention. These experiences reminded him that medicine was not only about technical skill but also about restoring peace of mind. The satisfaction came from knowing that someone could move forward without fear. Beyond individual care, he accepted leadership roles that allowed him to guide teams and shape clinical standards. Serving as a department leader required balancing administrative responsibility with clinical integrity. He emphasized collaboration, encouraging colleagues to share knowledge and uphold high standards of care. Leadership for him was never about authority alone. It was about setting an example of professionalism, respect, and accountability. By supporting colleagues and staff, he helped cultivate environments where patients benefited from coordinated and thoughtful care. As a healthcare provider, his duties went beyond his hospital duties as he often provided uninsured patients with treatment and assistance without payment. He also determined that patients often needed access to healthcare but could not access it because of lack of affordability or knowledge of how to access it. Providing patients with support over time allowed many of his patients the ability to make informed choices with regards to their available treatment options and preventive measures. His community consultations were a reliable source of information for many people, including some who were hesitant to seek formal medical treatment. His practice was based on the notion that the need for care should be based on the needs of each patient and not necessarily on the person themselves. Medical knowledge never stood still, and neither did his curiosity. Continuous learning was essential to maintaining excellence. Even after stepping away from daily clinical duties, he remained engaged with medical literature and developments. Reading journals and staying informed allowed him to contribute meaningfully in conversations about health and prevention. This habit reflected a respect for discipline and a desire to remain intellectually connected to the field that shaped his life. Compassion, commitment, trust and service are not mere ideals but rather everyday rituals. Compassion expressed itself in his words to patients and their families. Commitment was seen through long hours and meticulous follow-up. Trust was established by being open and reliable. Service could be observed in his manner of helping whether a patient was financially or socially strapped for assistance. These principles create an environment for him to make decisions, both large and minor, as well as how others within the hospital and community perceive him to be. Asif Choudhury MD spent years practicing the interaction with physicians to learn about the partnership of the two parties working together towards a goal of restoring health. He found all physicians have feelings that are a burden they must carry around every day due to a negative outcome. He recognized that a patient will also experience joy when they receive excellent care from a physician. Together, these two things have created a level of humility and resiliency for him. He has developed much more empathy for both the patient and the other providers, which supports the value of working together to foster collaborative relationships and mutual respect in healthcare. His balance and community connection, outside of medicine, are reflected in the things he is actively involved in, such as sports, cultural events, and discussions about education. He uses each of these outlets for different types of expressions and engagement with people outside of their clinical roles, which helps to reinforce the commonality of their values and experiences. In addition to serving as someone who could provide practical health advice in his personal relationships, such as friends or community members, he demonstrated that his level of caring was not diminished following his retirement from the formal practice of medicine. Asif Choudhury MD continues to be an advocate for the values and principles that have defined his career. Even though he is no longer a practicing doctor, his influence continues through mentoring, informal support, and community service. He is still committed to being educated about, preventing, and being thoughtful in all aspects of life. He uses the same sense of obligation that guided him in his early years to help others in their everyday lives. His experience has shown us how the work-related values of a professional can carry on through their other roles and activities to contribute to the development of their purpose. The common thread among many who reflect on their lifetime in medicine is a commitment to serve with empathy. A life spent with Dr. Asif Choudhury, one founded on careful listening and responsible action in developing patients' overall wellness, has been an extraordinary journey. Every person Dr. Asif Choudhury, MD, has served, received quality healthcare through the most excellent healthcare professional, having shared in his compassion and profound sense of concern for them. The qualities Dr. Choudhury utilized to provide clinical care to his patients will continue to be important to his life today. To have a true legacy as a professional is to have provided care to those deserving of your time, effort, and commitment in creating a legacy of trust and having improved an individual's life with modesty, thus establishing a true professional legacy that will be there for years to come.